So continuing from where we left in our last session. So Abhishek, the next question is, you mentioned centralization of power. That is a problem. So what can we do about it? Is it the is it giving power to people, and how can we do that? Can AI come into the picture? If AI were to exist today, would it have handled coronavirus pandemic anything better? Because I'm asking you because you are just the right person. You are the AI expert. And a few days back, as you know, Geoffrey Hinton has expressed his apprehensions about what's going on with AI. What do you think about the use of AI?
Um, this, the first answer, the first question, which is what to solve. I'm not sure how much AI can help, but so I can like first answer like what would help, and then we can see what role AI can play in the solution. So I think the biggest thing is so the biggest thing that's stopping US doctors from like following their own conscience and conscious and following their own knowledge, and do what they think that is right is the threat of losing their jobs. Like if they don't do what the FDA says, even the FDA decisions are almost like these days they are almost always motivated by profits of the companies. FDA is these days like for sure more about protecting the profits of pharma companies than protecting Americans. So it's very, very clear. Like they approve drugs that have like no evidence of in doing anything good, and they get in the way of people using good drugs like NAC. Like during the COVID, they tried to stop NAC. They harassed doctors who were trying to sell like vitamin D, and probably that's more effective than anything the FDA promoted for COVID. So given that, like I think the biggest thing we need to do is like drop these threats. Like there is like if you like the FDA's power need to be controlled, so they cannot tell doctors what to do. Like doctors, like at the very minimum, if the doctor is giving some advice to the patient that goes against the CDC or FDA. Maybe at most the doctor has to say this explicitly to the patient, but beyond that, the doctor can do anything. It's a private decision between a doctor and their patient, and the medical authority should not get in between and not dictate what's unfortunate these days is like doctors have become mostly like robots. Like the FDA says that if there is this disease, like then this is the protocol. If you have these symptoms, then do this. If you have this symptoms, do that. So the doctors have become like mostly robots. Like their hands are tied and they do exactly what even AI like they do exactly what stupid AIs can tell you to do. Like AIs are passing these exams, like medical exams, with flying colors. So like in their limited role, I think AIs can probably be just as good as the doctors,
Mhm.
as much they are allowed to do. But there are many great doctors who are much better, like who deeply understand the problem, who deeply understand the literature, who deeply understand like how the science works, and they can separate all that kind of bullshit from the real scientific truths. So those doctors, they are much better than AI, at least for now, in my opinion. And those doctors, if they are free to like practice medicine honestly with doctors and without the threat of losing their jobs, and they can like even educate the world. So I think that's the biggest thing like we can do is basically freedom to practice medicine honestly without the threat of losing jobs, and more important like freedom of speech. Like these doctors, like California has laws that like would take away doctors licenses even if they just speak something that is against FDA. So it's a very bad situation. So that needs to be fixed. And like in the US election, there are some candidates like who are very much also inspired on these topics, and who also understand these problems, and whose main like campaign agenda is to solve these problems. Like Robert F. Kennedy Jr. He may have said some
Right.
Sometimes he does say some things like he get carried away a little bit more.
Yeah.
Like he considers some correlation as causation. He sometimes does that, and not everything he says is right, but he's much more right than anybody else. Like I think he's much more right than Fauci. Like if you just look at what Fauci predicted and what Robert F. K. Jr. predicted, you would see that at the end of the third year, Fauci's predictions were more wrong than RFK Jr.'s. And to me, like the better expert, like is the better scientist is not who has better degrees. The better scientist is one whose predictions come true more often. So if we go by that metric and forget about the degrees, like RFK Jr. is more right, even though he's not always right, he's sometimes wrong. So so there is a little bit of hope. I don't know if his wins, but I think the more the public demands this freedom of speech
Mm.
and freedom of doctors to practice, the more aware the public is, the more hope there would be that maybe not in this year, maybe 4 years from now, there will be enough demand for politicians who stand with us on this and go like for full blown freedom of freedom to practice medicine without the threat of losing jobs based on FDA guidelines and yeah and freedom of speech. So I think that is the and to a second extent even the lay public should try to understand better like what is medical evidence, should understand the basic principles of medicine. Like when we go to school, we learn a lot of things. Like we learn like the geography and like which city is at which place on the map. Like I think that's not very important. Like instead of that, if we
You're
teach
right.
children how to judge medical evidence, like what is the probability theory like, and whether you can look at some scientific experiment that was done, and you can look at the conclusions and see whether the experiment justify the conclusions. And that would be a better skill. And even in medical school, they don't teach that. They just teach theories after theories and after theories. They don't really teach them much to judge whether these theories that are mostly written by pharma companies in their interest, whether those theories are really scientifically true, whether whether there are experiments justifying those theories. They don't do that. So I think to some extent that's the harder thing to solve. I think maybe a better change in curriculum or good books or video lectures or maybe a good course about it could help that everybody could take. Um, so
Yeah.
the other question was whether AI can help.
Yeah.
Um, Yeah, I'm not so much of an AI expert anymore. Like I used to do some research on AI like maybe 10 years ago, but I work in a different field of computer science.
LLMs, you don't
No,
see it.
no,
Okay.
no, no. I mean, like, they have good potential. They are very good. I use them, but I'm not an expert in LLMs as much I, anymore because I used to do AI and machine learning like 10 years ago, but not anymore. I work in a different field of computer science. So I don't know enough to like make good predictions of where they are, like where they would be, like how much intelligent they would become and how soon. I don't know at this point to say how much they have. But in the current state, like they are not good enough to like replace the real smart doctors who can deeply understand problems. Like the AI isn't there yet. Maybe it would be there in like 10 years. I don't know. I don't know enough to predict. I think no, maybe probably nobody else knows enough to like make a very concrete prediction. Like this GPT thing happened
Mm.
and everybody was surprised. So almost nobody saw this coming. So it
Mm.
looks like, yeah, and that was when I used to do research in this field. It was my understanding also, like nobody really knows how these things work. They do incredible things, but nobody has a deep understanding of how these things work, and that's why like I was not very happy about working in this area, and I chose a different field. I do like um, computer aided like mathematical proofs and stuff like that.
Yeah. The reason I asked this question is because last year we had the privilege of listening to Dr. Devi Shetty, who is very renowned cardiologist in Bangalore, and he said in future we will have a maybe a hybrid approach where whenever a patient comes, there will be a robot or something, and that will scan that person's entire uh, scan through the entire previous records, medical records, and then they will present this data to the any medical expert, so that medical officer or doctor is not just trying to diagnose or find immediate relief to some problem. They will be getting enough data so that they can find any pattern as such, or they can see how it is leading. So was there a ACL surgery, was there a pulmonary embolism case after the ACL surgery 50 days later? So all these things, clot, what was there pleural effusion? So if we have enough data, we can correlate how things are moving. But if
Yeah.
I just drop in and say that I have breathing problem, the doctor might not be knowing why I have breathing problem. But I want the solution on the stand, because this is very this issue at that time, at that moment of time, becomes a cause
Yeah.
of like a matter of immediacy.
Yeah,
So
like in
he was,
general, like having more information always helps, like having more data, whether it's human making the decision or an AI making the decision, like having more information always, in theory, can lead to like better decisions. Like any rational agent will probably make better decisions out of better data. So yes, collecting better data is definitely a good thing. Except like, I mean, I don't know if we should go into the standard, but like, yeah, there's always this risk of like privacy and
yeah,
somebody using that
yeah,
data against you. But
absolutely. Yeah.
go to that topic some other day. Uh,
That's well said. And the other point which we were talking just now, uh, do you think more focus is required on basic research? Because these days, over last few years, not just years, even decades, I think we are we are actually obsessed about applied sciences, applied research, and a lot of counterintuitive papers, and that valor associated with this tenure tracks faculties. We don't see them anymore. So do you think it's time to go back to pure research, basic research, or because these corporations, they will keep funding for counterintuitive papers and uh, all those applied theories, and that will mean that we don't have fundamental basics covered. So there's a money angle here. I don't know what's the solution, but just want to hear your opinion. What do you think we can do to make things better?
There is definitely a money angle. There is a huge bias in medicine. Like the
Yeah.
only the profitable, like you often hear these medical experts or a medical expert, they would just say that this X like turmeric or some like traditional thing that has is bogus because it has no evidence that it works.
Hmm.
Yeah, but not having there is no evidence that X works. It's different from saying that X doesn't work. Like for that, you need evidence that X does not work. So just because you
Yes.
haven't done trials to evaluate something, you can't say that something doesn't work. So that's the huge. There's a huge bias and problem. Like the only things that are that have trials, even judging whether it works, are the expensive pharma stuff. So it's a huge problem. And one thing that I also wanted to I've been wanting to understand for a long time is why does it take so much money to do trials? Like for example, you just want to know whether turmeric works. Let's say you want to know whether turmeric works for cold. I don't know. Maybe it works, maybe it doesn't. But like a group of citizens, like 1,000, like 1 lakh citizens can come together, and they, without any funding, need for external funding, they 1 lakh say citizens in India, they come together and they decide
Yes.
that half they toss a coin, or they do some randomization, and they decide like half of them would try turmeric for the next 2 years and half of them would not. And at the end of the day,
Yes.
we compared which group had more cold infections, and we have a very good trial. And to do that, like it should cost like $0. And to do this trial currently, like any professor would charge like millions of dollars from an NIH to do this trial. So I think
Yeah.
we need a better infrastructure to do like these trials at a citizen level, completely bypassing the pharma. And
That's a very important point. We can actually do it in $0. That's something which is nobody's thinking about it, but that's a very important point, I think. So,
yeah, I hope
Abhishek,
that yeah, go ahead.
few days back, as you may have heard, uh, WHO Director General, he has again warned of another severe pandemic. What do you want to make out of it? Is it something to be scared about? The world should be scared, very scared, or we are better prepared because now we have the vaccines. I don't know. I'm not a scientist. I'm not an expert. I just want to hear your opinion. What do you infer from his statement? Because I think day before he said that something even worse than COVID is coming and world should be prepared. I don't know. That sounds scary.
Yeah, it's like for somebody who is so much like whose funding comes so much from vaccine companies directly or indirectly, like they're always look honestly like this. Yeah, this may look like a conspiracy theory, but I think there are so many observations, as I pointed out before. Like they didn't let any, like even monoclonal antibodies, which have very good evidence, they tried to suppress that in favor of vaccines. So you can't really explain all these observations without, the only theory that explains these observations is that they are completely the goal was to sell vaccines, not to
Hmm.
prevent, not to reduce human suffering. So, and with that theory, like makes complete sense that they always want to scare people to create to sell new vaccines,
Hmm.
and God forbid, like there is I personally think yeah, in the beginning I said that there is not good evidence whether it originated in a lab or not, but my guess, very uninformed guess, is that it did originate in a lab,
Right.
and I'm worried that they may do something like this again. So it's a very scary world, and nobody
Hmm.
knows what they're doing, what these guys are up to. Like in the ideal world, like I think I heard Glenn Greenwald say once, like in an ideal world, like we should know everything about what the governments are doing, and the government should know nothing about
Yes.
almost nothing about what we are doing. And it's the complete opposite. Like governments know everything about what we're doing. Like they install like these spywares on phone, and like they know exactly what everybody's talking to everybody. They want to outlaw encryption and private
Hmm.
messaging, and they want to know everything about what we're doing, and we know almost nothing about what these governments are doing. And like even what the elected representatives, like in the US, I don't even know whether the actual government we elect is the one, actually is Biden really making the decisions, or are his decisions made by like permanent powers, like the FBI, the CIA, and the pharma
Hmm.
companies, like these bureaucrats. Like in the case of medicine, it was very clear, like the decisions that had so much impact on civil liberties, they were made by Fauci, like who had been there for 40 years. So like we are effectively ruled by people, unelected people who are there for like 40, 50 years. Um, yeah, so it's a scary situation. So what to make of it? I don't know whether they're right or wrong. It's hard to say, but at least what I do know is they have very perverse incentives.
Yeah. So, do you think the world can do better to move a bit more towards the preventive side of healthcare? Because what we saw in 2020 was that, of course, we did not have 9 billion ICUs and hospital beds for 9 billion people, but there was a real panic. So the curative side of healthcare, it comes with certain restrictions. Right? Everyone cannot. I can tell you about Asia because I am living here in the second wave, the way they call it. There was a massive panic, even if situation was worse than what it was in 2020, and there were no hospital beds. And people like us who were volunteering, we were constantly on telephones and coordinating with authorities. Not a single hospital bed available in any hospital, and the patient is actually in deep pain. That was the time I realized we don't have hospital bed for everyone. So s- are we somewhere collectively? are we doing something wrong in putting too much of emphasis on curative side of healthcare? Why don't we ensure that we don't fall ill that often, and we are not that vulnerable? So for everything, what I see is people taking some prescription medicine, uh, something steroid or something for even small thing, paracetamol. When we were kids, the, the Dolo 250 was given. These days, I see everywhere, every kid, 6, 7 year old kid, they are given Dolo 650. So, what is your opinion about it? Like, too much of medicines, are they going to help human body really? Uh, because they also take a toll on the kidneys. Too much of medicines, painkillers all the time. Is it a happy world where we are heading to? Third largest pharma industry.
Yeah, so there are two
Because
orthogonal
I think
issues.
this is,
Yeah,
yeah,
go ahead, please.
yeah, yeah,
You were saying something. You're saying you think. Hello. Okay. Um, yeah.
yeah, yeah.
So I think there are two orthogonal issues. One is prevention versus cure, and they do a lot of prevention, and actually uh, there is a lot of money in prevention. Like I think
Mm,
what pharma is focused on is not like one-shot treatments of diseases. Like that would not make them a lot of money. Uh,
right.
so what they are looking for is like you have to take a pill every day for the rest of
Mm,
your life to prevent, like for heart attacks, like they you have to take a statin once a day for the rest
mm,
of your life. So that is good money maker for them. And never mind, it's not very effective. Like for diabetes, you have to take insulin every day for the rest of your lives.
yeah,
And it's well known that like there are very good trials showing that if you take insulin, like your diabetes progressively becomes worse and worse. And by now it has been proven like if you do other things, like if you do fasting and better diets, you can, with fasting at least, you can easily cure your diabetes like within like
yeah. We
in
have
most
data
cases.
for it.
Not yeah. There's good data for this now, and then you even cure even the other downstream symptoms of diabetes. You get less headaches. You get less uh, respiratory infections. So it's like all round benefit. Whereas like if you treat insulin with diabetes with insulin, like, you get progressively worse and worse and worse. Although
Mm,
there are these days like better drugs that are coming up that are not so bad, but it's yeah. So they do prevention, but the problem is mainly the motive. Like the motive is always to make money, and I think many of these doctors are who like suppress, who tried to like scare people away from fasting. Like 5 years ago, intermittent
yeah,
fasting and fasting wasn't cool. Like if most doctors thought that it was a very bad idea. Like even now, people think that it's a very bad idea when like it's probably the most scientific thing to do because and the reason is because it
yeah,
probably has the best evidence because most of our billions of years of evolution, that's how we ate. Like we did not have supermarkets, we did not have like continuous access to food. So we used to hunt or scavenge something. And if we find
yes,
something, we have big meals. And if we don't find something, we go for days, like at least a few days without food. So that has better evidence than anything modern medicine has to offer. Like, like just look at the scale of time. So yet fasting was considered like very quackery and
yeah, exactly.
insulin is the way to go. So so when they even when they do prevention, they do it wrong. So I think that the root cause is just that profit motive.
Mm,
And such a, but another problem is also that it's very hard to know the long-term harms. Like it takes like 70-80 years to really understand the full adverse effect profile of a drug. So, like, just consider Tylenol. Like, everybody thought it's the safest thing for kids, but now, like, there is research showing that at least in mouse, and there is at least observation correlation data saying that if kids get Tylenol very early in life, like when they are 1 year old, they are more likely to have like mental development issues.
mm,
Similarly, if like pregnant women take Tylenol during pregnancy, they can be that at least correlated with mental development delays. And there are also like good experiments in mouse. Like as like these trials, they were just done like 2 3 years ago, and Tylenol has been in market for like 60 years, 70 years, or even more. So it takes a lot of time to uncover the entire adverse effect profile. So we should always assume that any new thing has a lot of adverse effects, most likely, and we should like better appreciate the unknowns. People do not do that, and that's very sad in medicine. Like people should know what they don't know. Like just the new medicine that just came, they should appreciate that we don't know all the side effects. So we should focus more on things that have stood the test of time, like the things that our grandmothers
Yeah.
did for centuries. They have at least stood this test of time. So at least they are probably safe. So in the absence of better evidence, I think
Yes,
we should
exactly.
also consider that. And ironically, like these scientists, they think that they like think that grandmothers suggestions, the additions, they are like useless, they are not unscientific. But the problem is that they don't know what science is.
Yeah.
They, they just think that they have done a trial of 1 year and they think that they know everything there is to know about that medicine. They don't appreciate what they don't know, which is like it takes, they don't know the complete long-term side effect profile. Not just long-term profile, even short-term effects. They take a lot of time. Like somebody sees a correlation, like if somebody collects a perfect long-term data, then we can maybe find these adverse effects sooner. But the way it has been going for the usual drugs, even short-term effects take like decades to be found. Short-term adverse effects, because nobody, the people who did the trial, they were not looking for everything. They don't record everything. They don't.
Yes.
So it's
And to add to the problem, marketing can do anything for you because the entire America, I think they know this truth that cold drinks, what you call soft drinks, it's not healthy. But Coke, they're not selling. Not to take the name of this person's brand, any soft drink for that matter. They are selling happiness in the bottle. They're not selling the soft drink itself. So they run campaigns like share a Coke, share a Pepsi, share a thumbs up, whatever.
yeah,
I'm not trying to take any particular brand here. So they're basically selling happiness in the bottle, and they are running personalized ads just like they used to run smoking ads in 1930s and 40s in America. It's available thanks to internet.
yeah,
Uh, but the damage was done in when we were kids in our countryside places here. We used to get lemon waters. Now come 90s and all these personalized ads and televisions and all these like campaigns uh, in every marriage ceremonies in rural India, the countryside. And I'm sure that was the case with other places in Asia as well. Now, if suddenly everyone has a soft drink or cold drinks. So this HFCS, I think high fructose corn syrup, this is not good. And now people know this. But it took us some time to realize because this is coming from some different place. And it took us time to realize that it is not good for us. Diabetic, it makes us diabetic and it
yeah,
spoils our toes.
yeah,
So marketing and money money can do anything. so
yeah,
so coming back to this point of vaccines, I'm not trying to make this controversial discussion, but just wanted to understand because do you think this the use of this word anti-vaxxers is slightly derogatory because there has to be an allowance for some counter view? I'm not referring to Andrew Wakefield study at all. I know, like there are just it's just too volatile debate. But if so many people all around the world have some at least one or two apprehension about vaccines, what's wrong for the medical science fraternity to come up and conduct open discussions? I mean, why they're categorically saying that anything that is opposed to the idea of vaccine is wrong? And there are when we have sufficient data, by the way, that tells us that there are side effects. There have been cases in, I think, Denmark, in Norway, and for some time I think Covishield was banned, I guess, for some time because of the clots and all these cases. So do you think 100% it's a bogus debate, or do you find some merit in it, that there has to be a debate at least on vaccines, on the efficacy of vaccines? I believe at least people should be allowed to speak up if they find some doubt infections.
People should be allowed to debate everything like that. And then nothing
Yeah.
should in science. There's nothing beyond question. Like science is the like questioning is the main principle of science. Like if you don't,
Yeah,
if
exactly.
you can't just follow the science. Like you
Yeah.
have to understand the science, and you're supposed to question the science. You're not supposed to like follow the science. Like that's like you follow religions, you don't follow science. So this is yeah, everything should be questioned. But I think like I come from computer science, and before computer science, I was fascinated by physics. So like in these areas, like these are very great like triumphs of science, like what humanity could achieve by like the progress in math, physics, and computers is like tremendous. But at the same time, you look at medicine, like that science is really not quite at the same level. Like it's so-called science, but it's just like a consensus of so-called
Mm,
consensus of like the loudest voices and most well-paid voices in the academia or places like of DSCDC. So that is really not at the same level. Like most of the predictions of the theories, like they've been wrong. Like a Nobel Prize was given for like somebody, the person who discovered cholesterol. I think two scientists were given a Nobel
mm,
Prize when they discovered some mechanism, and they claimed that because of this discovery, heart disease would disappear after 20 years. It has been like many more years than that, and we're not close. Like younger people are getting more heart disease. So
mm,
like the predictions have been wrong and wrong and wrong. They told us to replace like ghee with like with like canola and sapola, and that turned out to be a disaster. That turned out
mm,
to do more harm. So very often it's a very common story that things that were promoted to do X, predicted to do X by the experts, did the exact opposite. So, and that's not a sign of a good scientist. Like as
yeah.
Richard Feynman said, it doesn't matter what the pedigree of like who's making the claim is. Like he may be the top expert, but if his predictions don't come true, then it's a useless, worthless theory. So yeah, everything has to be. So the point I was getting at is like the medicine is medical science is way subpar like than these other fields of science. And in
Yeah.
medical science, the field of vaccines is the worst. Like it is like very subpar than even other fields of medicine. So like if you want to get a drug approved, you have to do like a 5-year trial of 5-year proper randomized trial. And if you mess up, um, if there are some side effects, the companies get sued. And
Mm,
but in the vaccine, in case of vaccines, like the COVID vaccines, and many vaccines are approved without such long-term trials judging
yes.
uh,
Yes.
the long-term harms. At least they're not randomized for so long. And the vaccine companies, they are immune from liability. Like at least in the US, like you cannot sue them if they do. So it's like a
Oh,
free pass in the free pass for the
we were
vaccine
not
company.
aware. Is
Yeah,
it?
so in the US, the law is like if your vaccine is in the childhood schedule, CDC childhood schedule, and I think to rephrase my discussion, the end goal right from 2020 March was to get the COVID vaccine in the childhood schedule. That was the goal. Like
Yeah.
these are so harmful to children, and children have almost zero risk of dying from COVID. Why are they still adamant about giving COVID vaccines to the children? They're not even
Yeah.
so adamant about giving it to adults anymore. But they're still, and why is that? Because once you get it in the childhood schedule, the only theory that explains all these behaviors of these humans are, to me, is like when they want to get it in the schedule, so that if once it's in the schedule, then nobody can sue them. Like even an adult got the vaccine and got injured, the vaccine companies do not have to compensate them. The taxpayers have to. And so the incentives are so messed up that I think this is the field that has the worst quality evidence than any subfield of science. Like medicine is the worst in among other fields, and inside, even inside medicine, like the field of vaccines, subfield of vaccines has the worst quality of evidence. Like there are not good, like there look like take any like I think there was a good trial to show that the polio vaccine worked. I think when it was rolled out as a part of the trial. So probably there is very good trial done for that, and that's very good. But like there are many vaccines like DTP. There is no good quality randomized trial showing that DTP in adults has more harms than good. Like there is decent observational data, but there are also like some trials showing harm. So um, and of course like DTP was replaced by DTaP in the US. So there are many questions. Like I struggle myself uh, when I take decisions about myself and my family, I would like better data to make the decisions on. Like both, either is whether you take the vaccine or not, you will never be a happy parent. Like if you don't take the DTaP vaccine, like you would be scared of like the diseases
Yeah, scared
they are
something
very scary. Like I'm
is on
scared of
your
those
mind.
diseases.
Yes.
They are very scary
Yes.
diseases, and I don't want to help them. But at
Right.
the same time, you want to know whether these vaccines are safe or not, and there is not good data for that either. And the way like there is some observational data, but given there is so much bias, it's easy to like slice and dice data so much to give any conclusion you want. So there isn't good quality data to make the decisions on, and that's very bad. That's a very bad thing for parents, like who want to make these very crucial decisions. So there should be definitely should be more question, more debate. I'm not against any of these. Like there are concerns, but I'm not against like because these vaccines, the diseases they prevent, they are also very scary. Like tetanus is a very scary disease, so nobody wants to get it. So we should have better data and more debate and more discussion.
Yeah. Do you think this option should be left on the individuals? Because if I believe in smallpox vaccine but don't quite believe to that extent in mRNA vaccines, should it be left on me as an individual? Because what happened is, if if indeed I have to take a vaccine, I would have ideally like to go with Covaxin because it's a like tried and tested way, inactivated. But if you are forcing me to take Covishield or live virus because you want, you will not allow me, you will not provide the visa, you will use your rights to stop my travel, international travel. So that leaves me with no other option. People like me are left with no other option because we are being penalized for something which, for not doing something uh, which we personally don't believe in. For example, let me tell you the example of Djokovic. The entire world knows what happened. The way very unceremoniously he was treated, deported back in the Australia Open last year. Of course, this year was kind of poetic justice the way he won. But last year, you don't treat a legend like that. And just because he said that I'm not against vaccines. I just want to say that I don't need it and it doesn't suit my body. Human body is different. So why should I be subjected to something which is foreign insertion in my body for which I am not ready? Do you think this is a human rights issue as well? Or for the good of the world, everyone should take mandatorily, must take a vaccine? I don't have an answer. I feel it should be left for individuals to
Yeah,
uh,
that's what I also think. Like if there it should be left to individuals. That's my like I'm a libertarian mostly, so that's obviously like my that's what I think should be. But there is a case to be made. Like if there is a vac in theory, if there is a vaccine that's very effective and that we have
mm,
solid evidence that it prevents the disease and it has no side effects, then there is a case to be made that like if and like if it's very and if the disease spreads very easily and unless everybody takes we cannot eradicate the disease in that case
mm,
like if we leave it to individual choices the disease would not be eradicated so even though I would personally not to make that decision I would not decide that but I can live with that decision like if in case if in that limited circumstance where there is a virus that spreads very easily, and so almost everybody needs to be vaccinated if we want to eradicate it, and eradicating it is very important. And we have a vaccine that is very effective, and like it completely stops transmission, and that there is good data that it stops transmission. And then we also have long-term data that it's safe, like at least like 20 years, maybe 10, but ideally like 20 years randomized trial to show that it doesn't have any safety issue, significant safety issue. Like at that point, maybe I would not be very unhappy if somebody wants to mandate it. Um, but none of the actually none of the vaccines have that level of good data,
Yeah.
have
Yeah.
have enough data for mandating. Um,
Mm,
yeah, yeah. None of the vaccines. Like there are some vaccines that come quite close. I think the MMR vaccine, I've only
mm.
seen good data about it. But most of the vaccines, they don't have good data of uh, safety, at least. And like the things like the flu vaccine, like they're not very effective. Almost everybody knows. Like it's like it used to be on mainstream news that it's like only 20% effective. I think you're better off getting vitamin D.
That's scary. Yeah. So, Abhishek, one important point you mentioned in our last interaction was when I asked you if the Asian people who are supposed to have a better immunity as compared to the West because they have seen poor infrastructure. Because I remember that in our childhood we used to drink water from anywhere, and we were okay. So we thought that our level of immunity is much higher as compared to people from West who come and they cannot survive without mineral water. But why is it that their life expectancy is much more as compared to the Asian countries who are supposed to live longer? And in response to this question, you put it very brilliantly. You gave an answer that life expectancy is not always about healthy life expectancy. So I don't know about what's happening in US. What, according to you, is the uh, immediate thing that we can do to move towards a healthier world? Because uh, back here in Asia, they say 65 to 70 is, which I am not ready to buy, because given the kind of like life we have here, at least for reference, through our grandmothers, the kind of practices, we should be living much more healthier and better mentally, physically, psychologically, spiritually. So why is it that the West has more? I'm asking this question again because uh, I don't know about what's happening in US. So it's more on the solution part. What do you think is the immediate thing we are lacking and we can do to move towards a world where we have more healthy life expectancy all around the world, not just in West or East? Less dependency on medicines.
I think that's the holy grail question in medicine. Like if we solve that, like that's the most important question in medicine. The most important question is not whether we can solve coronavirus or prevent XYZ disease. Like the ultimate goal should be like we should like
Mm,
aim to increase the overall average overall health span. This is like the number of years you live, being sufficiently healthy and not like rotting in some nursing care without any loved ones and without
mm,
being dependent on people you don't know, not being treated well by them. So um, that's the holy question, holy grail, and there is no simple. We just don't know enough to have a good answer to that question. Like it probably has a lot of factors, like a lot of things we can take from the traditions, like
mm,
live like our grandparents, like they do things like those things have proved the test of time, and not like just start doing cool things just because our celebrities are like, promoting it, or the cool kids in America are doing it, so we should also do it. We should not have that mentality, like do things that have stood the test of
yes.
time. But that's not enough. Like maybe there are some good things also about Um, yeah, the Western medicine has invented very good things. Like there are some vaccines that are really effective in reducing disease. So we have to like pick and choose what are the good things and from each part of the world and understand so what's the best strategy and so like I think I cannot give you an answer, but I think what we should do is like um yeah, have a better strategy for doing experiments to judge which things work or not. Like we don't do that enough. Like
More
there are
empirical.
more empirical, and yeah, the thing I was talking about, like citizen scale experiments about what works and what not. Like we need to do like every day should be an experiment. Like if it's not very important, like if it's not life critical, like if you're dying, then definitely do things
Yeah, right.
what is best guessed to save your life. But if you're not dying, like if you're daily life, we should all make every day an experiment and try to see what works and what not. And there are good ways of doing it, like randomization.
Right.
And so yeah, it's your question is the holy grail of medicine. Like that's the most important question in medicine, and there are no simple good answers. At least not that I can go over in 5 minutes. But the strategy should be that we do more experiments and try to figure that out.
Mm. And I have few more questions, but I will leave it to our next discussion because I wanted to discuss things like cloning and egg freezing, and there are so many interesting things. But I will respect your time and I will keep it for our next discussion. So just to summarize this discussion, if something like what happened in 2020, 2021, it was not just about one medical case because so many people I have seen in front of my own eyes, so many people they have lost their livelihoods, especially the poor. You rightly mentioned that the poor became poorer, and that was very very difficult for me because I didn't have money and I could not help people who were actually starving. So that was a very scary thing. So many people lost their job. Even I lost my job. So I can understand it was not just about one vaccine. There were people in countryside places. They were saying, "I'm ready to die with this any virus, whatever, but allow me to earn my livelihood." They are farmers. They're very poor people. So my question is, if something like this is, God forbid, it doesn't happen, but if it happens in the worst case, contagion-like scenario, what we saw in that Hollywood movie, what should we do? That one thing which we could not do it right then 3 years back, and that we should do now because now I take WHO, Tedros Ghebreyesus' words very seriously because this this person has said that the world needs to be prepared, and I don't trust anybody in this world. I don't know the like. I'm not talking about any end game is near because we are already fighting wars all around the world, but this is something which is, I would say, as bad as a, a war because war is confined to select geography, but this has destroyed. I had no business with. I have not eaten or drank any bad juice, or I have not. I'm a vegetarian, but I have to pay the price. So this is something which people have paid the price for no fault of theirs. What should we do now? Every individual, if something like this happens, should we question our authorities' representatives more and more? That is one way, but even they were clueless. Or should we start developing more and more passion and hunger for knowledge for the medicines? Because this problem is happening because we assume that we know nothing and everything. Our life is in their control, and what Dr. Fauci says, I have to do this. So, do you think and a possibility where generalists like us, and like I'm not a medical expert, but I'm passionate about it. The only reason I'm passionate about it is I want to see a better world, and it goes through this medicine, of course. So healthcare. So, do you think scope for people, generalists like me, to make inroads and maybe uh, we should continue our hunger, uh, keep our hunger alive for medicine? Is that a solution? Because how do I know what's going on behind the scenes, behind the curtains, and I'm paying the price for no fault of mine?
Yeah, I think yeah, we were like, I think somebody, I read a tweet recently, like I think it was David Sachs who said they used to say that like if you are if you just observe evil and do nothing,
Mm.
you are partly to blame. And I think the new version is if you see evil and you are still disinterested in politics, you are partly to blame. So I think yeah. So we at
Good
least
quote, anyway. Yeah.
yeah. So I think these politicians at least they have a lot of power and
Yeah.
uh, I used to think like politics is the worst thing ever and I didn't want to get any close to it, but unfortunately like when it affects so much, like I personally had to move from California to Florida, like I left everything behind. In California, like I couldn't even go to a restaurant, and my wife, like her, she wasn't allowed to go to her office and so on. So I had to leave everything behind, sell everything, and come here completely uprooted everything. So these things, like yeah, this is not as bad as losing their livelihood. Like I'm still very fortunate than those poor people in India who like who would probably have survived COVID easily and instead died of poverty.
Absolutely.
Um, so yeah, so much of that like came from politicians, uh, and so and like yeah, there is a lot of corruption in the CDC, but it's the politician who makes laws saying that you must follow the CDC. Ultimately, it's the
Yeah.
politician who makes the decisions, and it's the politicians who can appoint better people to CDC, better people to have. There is no shortage of like good, very honest and very smart scientists who really you can separate the bullshit from real science. And they need to be appointed to positions of power. And
Yes.
so on. So I think we have to get involved in like good people need to be involved in politics. Yeah, that's my. I still don't know how to do it. I'm still trying to learn a little bit about politics, but I think that's very important.
But we cannot close our eyes anymore.
yeah, we
We
cannot
we are.
close it. And just like even observing, just speaking probably helps to educate more people. But that's what I've been trying to do. But probably we need to do more and also get into politics. Like people who have time can like. I think things are much better than India. Like you don't have like a two-party system where like
Yes.
you really have like two really bad choices or forever. Like I think
Yes.
you, yeah. So making new parties and making new political uh, fronts, political organizations to like and running for prime ministership, like good people doing all that, and I think we have to do that to save like yeah,
Yeah.
democracies and everything. Yeah, like it's just like yeah, more
So
than
yeah.
democracy.
Uh,
Yeah, there's a lot like not just in medicine. Like I think even free speech is under attack in the US, and like if you have no free speech, like I think we have nothing. Like there is no science without free speech. There is no like it's just we'll go back to the dark ages of kings and dictatorships if we lose free speech.
yeah. Let's hope. Let's hope we are moving towards a better world. Thank you so much, Abhishek, for your time. And it's always a pleasure going through your posts. And we all of us who are admiring and learning so much from your posts are actually growing through your posts and the way you share things. And thank you so much for uh, giving so much of your valuable time. And I wish we will take those topics which I could not cover today. Let's discuss on those topics sometime later. And it was a great session, very, very enriching. Thank you so much, really, for your time.
Thank you. Yeah, it was. Thank you for having me, and thank you. I also learned a lot from you, and yeah, we all have we all bring some skills to the table, and we all have good skills. So yeah, looking forward to yeah to participate in this important fight and make things better. Thank you for what you do, spreading good information and helping us.
Thank you so much.
Thank you. Bye.
You have a great day.
You too.